So some people may have allergies, and then we have to always ask questions about allergies, what allergies that they have to what medication or what product they have allergies to. And patients may have some allergies to the preservatives of Botox. So Xeomin is actually, it doesn't have the preservatives or the same preservatives, and that can be used for the patients that have allergies to those preservatives. So in that case, Xeomin will be safer to use, more because it doesn't have the preservatives that is not gonna cause the allergies to Botox treatment. Xeomin treatment and the safety, it's more about just any Botox treatment. Why? Because we wanted to be very specific on the amount that we're using and the areas that we're treating. So for example, we can put 20 units in the forehead area and get really good results, but we're not going to use 20 units for the chin area, because then it's going to be too much. So knowing exactly the amount of units that we are going to use in which areas, it's super important also for the safety. Not because it's going to cause any side effect in terms of like a bad reaction, it's more the look and also the area that it's going to, you're not going to be able to move it the same way. So there's always side effects when you get your Botox treatment. One is just because of the needle, like having a prick, that it's gonna have the risk of swelling and bruising, but that doesn't matter if it's Botox or not. And then another is more the botulinum toxin, especially like if you have any allergies. If you have allergies to that, you will know. The other thing is more Botox can migraine. So you have to make sure where you're going and who's doing the treatment in order to know exactly the areas that it's being treated. Something that it's important after your Xeomin treatment or your Botox treatment is, for example, no laying down completely flat. So that means that putting your head down completely or putting your head up completely, like completely flat, either like laying flat or like facing forward flat, like no swimming, especially for the next 2 hours. So the next 2 hours after your Botox treatment, try not to go completely flat, because it's known that until the Botox is absorbed in the muscle, it might migrate. So that's important that either you're reclined or you're completely straight, just go back to work. It's not an issue, just don't be flat for the next 2 hours. Another thing when you're getting a Xeomin treatment or a Botox treatment, it also try not to exercise the day of the treatment, more because it's gonna increase the temperature, so it's gonna increase like a little bit of the inflammation process, and because you had the pricks in the muscle, also it's not gonna settle the same way. So try to avoid exercising the day off. So you can exercise before coming to the appointment, and then after the appointment you're good for the day. Another thing that you can avoid before getting your Botox treatment is having a pain medication called NSAIDs, like Motrin, like ibuprofen, Aleve, more because those cause a little bit of blood thinning and increases the bruising. So try to avoid those before, like 2 days before your treatment. And then alcohol. So alcohol does the same effect, where it thinns your blood and then you're gonna have high risk of bruising. Another way of putting is exercise before your treatment and then drink after. In general, all the Botox are made from the same botulinum toxin type A. So all of them are gonna have that. What is different in Xeomin is that Xeomin doesn't have the same preservatives. So if a patient has allergies, most of the time the allergies are going to be to those preservatives. So we can use Xeomin in order to treat the patient, because it's not going to have that allergic reaction. So in that way, Xeomin is safer to use.